In March, the Mexican government insisted that Mexico would be spared the worst of the coronavirus pandemic due to its early implementation of social distancing. But as the weeks passed and California's own curve flattened, the situation in Tijuana has become dire and deadlier than the situation in San Diego. 86 people have died in Tijuana, and across the state of Baja California, 136 people are now dead from the virus. Yesterday was the deadliest day in Baja. 37 people died.
Esta es la curva de Baja California.
The number of infected continues to rise, with 1,047 confirmed coronavirus cases in Baja California. One huge problem facing Baja California? The lack of ventilators. There are currently just 10 ventilators still available in Tijuana. A hospital worker in Tijuana sent KPBS a note describing conditions at Clínica 20, which has seen a huge influx of COVID-19 patients and is now building a tent to handle overflow. She says officials are being very secretive about the true number of patients.
Están manejando todo muy hermético.
She said she's sure people have died while waiting for ventilators. Tijuana is actually a huge producer of ventilators and other medical equipment, but much of that equipment is set abroad, leading to conflict between the governor of the state, Jaime Bonilla, and its international trade partners. Under global trade law, Mexico is prohibited from buying many of the products it makes before they're shipped abroad. That has changed somewhat in recent days after Bonilla threatened to shut down factories that weren't contributing somewhat to Mexican efforts to handle the virus. But with Mexican factories along the border playing a central part in the global supply chain and workers there continuing to fall sick during the pandemic, every day that Mexico's factories remain open and without necessary safety precautions is another day that the pandemic worsens in the country. Doctors there, many already sickened, fear that the situation, already critical, will soon overwhelm the country's hollowed-out healthcare system. Max Rivlin-Nadler, KPBS News.